Hello, in this presentation today, I will speak about diabetes mellitus and the impact it has on our bodies, as well as how to monitor it so that we can control it and live a healthy life. To start off, um, let's look at the definition of what diabetes mellitus is. So I have a simple description that will also help us understand what diabetes mellitus is and how it starts developing in our bodies, so that we might also have a clear picture of diabetes mellitus and how it affects our bodies. So in this description, um, after we eat food, the food is broken down in the stomach into sugars, and this sugar is called glucose. This glucose, after being absorbed through the stomach or into the bloodstream, um, it gets higher or lower. And in the body, we also have a hormone called insulin, which is secreted from pancreas. And this insulin monitors your blood sugar level. And when blood glucose begins to rise, this insulin also does the same. So this insulin acts on the cells of your body and make them to take in glucose from the bloodstream. And some of these glucose is used by cells and some is converted into glycogen or fat. Um, so some glycogen or fat is also converted back into glucose and released from cells into bloodstream. And blood glucose level should always be monitored. Even sometimes if your body has shortage of insulin, or if the insulin is not working properly. So those people who are being affected by diabetes are also encouraged to control this sugar level, because if not, they may experience some complications in their bodies. So the next thing, we are going to look at some of the complications that comes. So the first one being kidney complication. So high blood glucose level damage blood vessels in the kidney, and this lead to uh, high blood pressure in people who are diabetic, and it also damages the kidney. And statistically, about 1 out of 3 adults with diabetes develop a kidney disease. And this kidney disease, it affects our kidneys in their functionality, and it also causes them not to remove waste products from the blood or remove excess fluid from our body. And this lead to some problems like heart disease and stroke. So always patients with diabetes are recommended to test their urine at regular interval, probably once a year to check for a protein amine. And having short amine in your urine is an indication that early kidney damage occurs. So the best way to prevent this diabetes-related kidney disease is to ensure long-term control of blood glucose level and blood pressure level. So move on to another slide where we'll also look at the different complications, which is eye complications, because people with diabetes, they also have a problem with their eyes. Probably they become blind. So this blindness occurs because of this bright is also a complications that affects our eyes, and it's caused by damage to blood vessels or very sensitive tissues at the back of our eye or retina. So this diabetic retinopathy is a major cause of blindness in individuals. And what happens is the damage to the eye starts when sugar blocks the tiny blood vessels that go to your retina, causing them to leak fluid or bleed. And these new blood cells, they stop working, and once they stop working, blood vessels leak or bleed easily. Having diabetes increases the risk of developing cataracts by 2 to 5 times, and at times doubles the risk of developing glaucoma. These are some of the symptoms of eye complication or retinopathy may not be noticed, but a person may just experience some complications that lead to blindness. So patients with diabetes are recommended to see eye doctor for a yearly eye exam, even if their eyes are working good. So now let's move on to another complication, which is nerve complication, and another one is also called cardiovascular complication. So this nerve complication is a damage to the nerve, and it's called neuropathy. And patients suffer from neuropathy, and this neuropathy damages cause different symptoms that range from pain and numbness in the feet or to the problems with function of your internal organs such as heart and blood. Some people may even have a loss of sensation in their feet, while others may have burning or shooting pain in their lower legs. Autonomic neuropathy is a damage to nerves that control to your organs, leading to problems with the heart rate and blood pressure, digestive system, bladder, sex organs, sweat glands, and eyes. And on cardiovascular complications, this has to do with the heart, and this is also the common cause of heart disease in a person with diabetes. And this also causes a hardening of the blood vessels in the heart, which build up a cholesterol in the blood vessels that supply oxygen and nutrition to the heart. And when this cholesterol plaques break, the body tries to repair plaques by sending platelets to suit. And since the arteries are small, the platelets can block the flow of blood, not allowing for oxygen delivery, and heart attack develops. And Lastly, let's look at how we can monitor diabetes. And the patient with diabetes needs to monitor their blood to help them manage their blood glucose levels to reduce the risk of developing diabetes complications, even blood sugar levels to be tested using a finger prick, using a glaucoma. So thanks for watching, and this was a nice